Janelle Morgan. I'm an ICU nurse at Peninsula Hospital here. We've been in contract negotiations for 14 months. Every time we have met, the hospital has given us another takeaway that they want, and we initially said that all we wanted was to keep the contract we had and with a nominal raise, and that was fine. We were not going to fight over any specific things, and they basically have brought the war to us. We had some proposals that we put on the table which were about health and safety and also staffing and patient care.
Which specifically are you asking for?
We want more say in how they deal with workplace violence. We want more protections with workplace violence. Just like in society, there's been a lot more violence, and we've had several episodes where nurses have gotten assaulted by patients. And also that affects other patients that are in the hospital as well. We also have a pandemic task force that we wanted to include, which would look at, bird flu, swine flu, whatever the pandemic is that might come forward, to protect everybody, that we have the right protective equipment.
So why are they fighting that?
They say that the processes they have in place already address those issues. And the reason we have proposed them is because the processes don't address the issues appropriately.
Give me examples of how that takes place. How the processes that they have in place are not dealing with the issue.
Basically, they have a committee that meets, which rarely has any bedside nurses, working nurses on the committee, and they discuss it. Bottom line, they don't really do anything about it. And the episodes, especially with the workplace violence, keep happening. And so we're really concerned someone's going to get really seriously hurt.
Now, they've said that your pensions are too high, and they want they want your pensions to be comparable to other people. What is the reality for the situation?
First of all, the pensions, I think, are realistic. They are not as high as they are reporting in the papers. If you talk to any nurse, they're saying, I don't make that yearly salary, I don't get that retirement when I retire. We have negotiated over 25 years, so whatever we do have, they have agreed to that over a period of time. And one of the main sticklers in the negotiations is that we have asked for information to prove the proposals that they need, that they really need, and they have refused to give us that information.
And what are the executive pensions?
I really don't know, to tell you the truth, but I know that there's
Aren't they a non-profit corporation?
Well, my husband was a CPA, and he said profits in a non-profit corporation are excess revenue. So and even the CEO of Sutter has said that they made X amount of money and had very productive last 3 years under his reign. So, they say one thing out of one side of their mouth and something out of the other.
And they're spending a lot of money on these scabs and replacement workers. How much money are they spending?
We heard through one of the physicians they're spending $1.5 to $2 million per strike. And since we've had 5 strikes, that's, $8 to $10 million. And if they'd put that money towards some of the things that we're negotiating, they would have come out ahead by now, I'm sure.
Well, apparently they make millions of dollars, the executives. They have hundreds of millions of dollars of profits. They're apparently lying to the people in San Francisco about CPMC and St. Luke's. You think they should be in control of the hospital?
Well, I see a lot of areas where the decision making, I really question how the decisions were made. They have built a beautiful hospital here, but in a lot of ways the nurses are finding it difficult to actually work in the hospital. The geography of the units and a lot of the workflow processes that we are forced to use, we believe nurses were never included in the decisions.
So the design of the hospital didn't consult the nurses?
They did have some nurses, but I was told by some of the nurses who were on the committees that they made suggestions, but they were not listened to.
And how much did they spend on this hospital here?
I can't remember. It's at least $600 million, I believe. It started out before they built it. It was $300 million, but by the time they got it built, it was probably $600 million.
So They also are trying to take away your sick pay, and what are they trying to do around that? Or
we have hours of sick leave that we accumulate, and they want to take that away and replace it with a short-term disability, which we already have some short-term and long-term disability as part of our contract. The sick leave that we have allows the nurse to be paid her full salary while she's out, and whether it's sick or injured or whatever. And the disability would only give like 66 2/3%. So we feel that a lot of the injuries that nurses are getting, and we have over 50% of our family birth nurses have had an injury which is related to working with computers.
How are they affected with computers?
It is the positioning of the keyboards, the mouse, the screens. They're ending up with neck, shoulder, hand injuries, nerve injuries. One nurse cannot go back to work ever. And nerve injuries take a long time. So by having this sick leave bank, they're able to at least have their full salary while they're getting better. In the economy the way it is, where maybe husbands are laid off or, they don't have the money, it allows them to stay out long enough to get better. And one of the VPs that we are negotiating with actually said in the meeting when they proposed this short-term disability, well, they felt by proposing this short-term disability it would give the nurses an incentive to come back to work. Which to me says you think that we're being malingerers and staying out too long, whereas the nurses need to stay out long enough to really heal.
Well, aren't there ergonomics to protect workers in hospitals and other places so that they're not going to be injured?
Yeah, we do have an ergonomic person. My understanding is her hours have been cut back. She works maybe half-time. I was very hopeful when this hospital was built that we had the opportunity to make a lot of ergonomic decisions, and we're finding as we've moved into the building that that's not true.
What does it mean? I mean, people go to a hospital to get well, to get and take care of, and then the workers in the hospital themselves are getting injured, getting sick. What is it? What's going on?
Well, I think the bottom line for corporations is their bottom line. And the nurses, if they were involved in a lot of these decisions, I think it would save the hospitals some money, as well as, it seems to me workers' comp. They pay a lot for workers' comp, so nurses that are out on workers' comp. So that, if they would just work with us and take some of our suggestions, but so often when we make suggestions, they listen and they say, well, we're working on this issue, but nothing ever changes.
Does workers' comp, are there carrier fight nurses who have workers' comp claims?
I have heard from the nurses, of course, thanks to former Governor Schwarzenegger, that the whole workers' comp program was overhauled. And I have heard from nurses who go out with an injury that it's sometimes months before they get an MRI to truly diagnose their injury. So that, on top of having to be out for a long time because of needing to heal, they are waiting before they were even diagnosed. And by then, sometimes the injury it's irreversible. And to see young nurses in their 30s who can't lift their children, there's something wrong. And the hospital has they have done some things, but the things they've done have not been adequate to really prevent the injuries or to help those that are injured get better.
So you're saying nurses who get injured here have to wait months to get proper treatment so they can get well enough to go back to work quickly, and then their conditions deteriorate?
I can't give you specifics, but I know of several nurses who have said it took me 2 months to get an MRI. And then they go in and see the workers' comp doctor, and they deny medication they need for pain or physical therapy, or then they finally approve the physical therapy and then they can't get an appointment because they often go through Mills-Peninsula to get the therapy. So
in other words, Mills Corporation, the Sutter Mills Corporation, are really trying to prevent the workers who get injured from even getting care in some cases?
I don't know that I can go that far because I can't prove that. I do know that it's the workers' comp system itself, which they pay into. And I don't know specifically, but I feel that they must lose money for the numbers of nurses that are out and having to pay, because sometimes a lot of the nurses will come back on what's called modified work, and they have to make room for them, but then there comes a period of time where they tell the nurse, we don't have any modified work for you anymore. And they also bring them back for modified work, and what they have them do aggravates their injury.
Why wouldn't the hospital want to take care of them properly, get them the treatment, and really get them back in good shape?
I totally agree, and I can't answer that question, because that is a common sense answer that I just don't see them really doing anything about it.
Is that contempt for the nurses, contempt for the workers?
I think it is just a matter of business. It is all about business. I don't even know that they intentionally do it. I just think it is about business. It's about the bottom line, and that's what they look at, what drives what they do on a daily basis, whether it be staffing on a unit, and they just say, oh, you're overstaffed. If you look at numbers, because for tens of hundreds of years, hospitals have staffed based on numbers. Thank goodness in California, through the California Nurses Association, we fought for 10 years and got ratios. Because what they would say is, well, you've got 10 patients and you get X number of nurses. And now we actually need to look at how sick the patient is, because maybe a nurse can't handle 5 patients, which is the ratio on med-surg. Maybe they need 3 or 4 because the ones that they have are so sick.
And the Hospital Association, Sutter, were trying to reduce what were they trying to do?
Yes, they are trying to appeal the ratio law, where right now what the law states is that the ratios will be in effect at all times, which means if a nurse goes for a meal, that another nurse has to take over that assignment, and that nurse cannot have another assignment. What the hospital would like is, let's say you're a med-surg nurse and I'm a med-surg nurse, we each have 5 patients, so that if one of us go to a meal, the other one watches 10 patients. And in this day and age, that is really unrealistic, because even the 5 really is a lot. It's a very heavy assignment.
So you could lose patients under this reduction of ratios.
I believe that there were, because a lot of times there are situations called fail to rescue, and I feel that as a nurse, I want to be proactive. I don't want to be reactive. In other words, I go into a room and I see subtle changes in the patient that I will then call a doctor to get medication or treatments or whatever, and I have prevented that emergency situation. When you have so many patients to watch over, you're not going to be there to intercede before the emergency, and I'm going to come in and I'm going to already find the patient in a real emergency situation.
So you end up in worse shape if you don't have proper care.
And I believe also falls, because we have an older population now. We have patients that come in the hospital, and due to either their injury or the medications that they're taking, they end up being confused. Some of them come in already with dementia and Alzheimer's. And when you don't have enough people to really be keeping an eye on the patients, you have more falls. And some of those falls can be consequential.
Now, the Nurses Association, California Nurses, have been fighting for single payer. How would single payer change what's going on here at Sutter?
I think if you're taking even though we're a nonprofit, I think if you're taking the profit out of the hospital and you are giving people a basic health care, that there have been studies that prove that it will save more money than they say that it will, but because the insurance companies like to lobby the legislature, and they don't want to lose their profits, and because they have people who are getting dividends from them, so that on the whole it gives a basic health care to everybody. We're paying for those people right now that don't have health care. It's just sort of an invisible thing. The hospital often will write it off as bad debt, and then they say that's charity care. Well, technically it's not charity care. And as a nonprofit, the hospitals are obligated to do a certain percentage of, I don't know that there is a set percentage they have to do, but they are to do a percentage of charity care.
So you're saying that even though they call themselves nonprofit, the reality is that they're trying to get bigger profits at the hospital. And these executives are making a lot of money based on getting bigger profits.
Yeah.
What's this all about?
Well, it's like any other business, you know, where they always say you have to pay CEOs a lot of money to get a good CEO. And then they turn around and say that nurses make too much. You know, Pat Fry makes $4-point-something million, and they are now saying that the average nurse makes $136,000. Well, how does this equate? And the Sutter Corporation itself, I mean, like I said, Pat Fry sent out an email months ago saying what a profitable year we had. So I wish I had we have a memo that has all the different salaries and profits, net income, and all that kind of stuff. And basically they function like a for-profit. And I know you have to make money in order to keep in business, but the way we see them spend money oftentimes is very foolish.
How do they spend money foolishly?
Consultants, for one. You know, you bring in a consultant who doesn't even know the community or know the hospital, and they want to change something. Whereas if you got some nurses who actually are in the trenches, and not even just nurses, but some of the other employees within the hospital, I feel that they would help them improve the care. But they pay these consultants hundreds of thousands of dollars, and I've been here for a long time, and we've been through a lot of consultants about different models of care, and they've all gone by the wayside. And so as far as I'm concerned, that's wasted money.
And what about the other workers here? Are they supporting you, the other unions? What's their status?
We only have one union, and they represent the operating engineers. We've not had a lot of communication with them. A lot of the non-RN employees have told us on the side, go for it, because they believe that what we do will help them. They can't say it verbally because they don't have a union to protect them.
So there are workers here that aren't in unions?
Oh yeah, we have the RNs, and then we have the engineers, but nobody else belongs to a union.
The LVNs and the orderlies and the kitchen are not in a union?
No.
Are you trying to organize them?
No, not me. They have tried over the years.
How have they stopped them from organizing?
They're just very intimidating. If they get any hint that someone's trying to organize, those people are somehow disciplined because of things they do in their job. They really, oversee what they're doing, and
so they retaliate against people who are pro-union.
They do, even though it's labor law. It's your right, but Sutter is very anti-union.
Would you say they have a union-busting history?
Absolutely, and I feel that this whole contract fight has been around that. That has been their goal from day one.
They would like to get rid of the union.
Yeah, but they've underestimated the nurses, and they've underestimated CNA.
So you're not going to go away?
No. I've been here 43 years. And I'm devoted to my patients. I became a nurse because it's just part of my makeup, and I really get a lot of reward from being a nurse. Everybody out here wants to just go and be a nurse and give the kind of care they want their families to receive. And right now we're not being allowed to do that.
Now, the Affordable Care Act, what does that mean to you right now at this point?
Well, we were told at the beginning of negotiations that they were going to lose all this money from Medicare and Medi-Cal. I'm really not well versed on the Affordable Care Act. I do know there's going to be changes, but I also do know that Pat Fry, who's the CEO of Sutter, he was the president of the Hospital Association at the time that the Affordable Care Act was being created, and the Hospital Association supported it. So why would they support it if they somehow thought they were going to lose money? That's my only...
So you're saying that the Affordable Care Act is not changing the profit situation with these hospitals?
I can't speak to it directly, but my sense is if they supported it, they certainly didn't feel that they weren't going to make money.
Because they're spending a lot of money fighting you and the nurses.
Yes, and I think it's a matter of seeing who could outlast whom. I think they underestimated the nurses. I think they thought they could squeeze us financially by the lockouts that they've done. But nurses fight on a daily basis for their patients. We work together when we have someone who's in crisis, and I think the nurses have galvanized around this to say we have to take a stand now, because if we don't, they will take away more and more. And we're willing to bargain, but they've not been willing to give us the information to make the decisions we need to make.
And what can people do who want to support you?
I would say call administration. I think ask the hard questions too about, there's a lot of donors for Mills-Peninsula. They need to know where their money is going. I don't know how much of the money goes to Sutter corporate as opposed to Mills-Peninsula in the community. And I just think support the nurses, period, because we're the last line of defense at the bedside.
And that's where people go when they need you.
That's right. And I live in this community. I've lived here for my whole life, and it's heartwarming for me to be able to take care of somebody or their family member who I've known. Church members, school teachers, people that I've known all my life, and they say it was so wonderful to see a familiar face when I came in. And that's what a lot of these nurses, they have repeat patients that come in for odds and ends of illnesses, and it means so much to have that familiar face and the compassion, and I think that's what you get with a human being, and they bring in more and more technology, which is squeezing us away from the bedside and the compassion that we give.
Good to know.
Thank you.
I'm just here to see you.